Oh, wait, who has the intro? You or me?
I think I do.
Okay, perfect.
Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Hey guys, welcome to another episode of the Civilian Medical Podcast. This one's gonna be interesting. I got my friend and co-host Sean, and we have another visitor on this episode. I'm glad we don't have like cameras going because our faces are probably gonna be pretty red during this.
Not mine. I'll be just fine.
Okay, so my face is probably gonna be pretty red. Like I'm just gonna cut the mic off and just giggle like a little girl in middle school.
That's fine.
And like that's gonna what happen. So we have our friend, the CombatMidWife. We have been trying to get her on the show for like 10 years now.
Yeah. We just weren't big enough, and she was like, "Yeah, I'm not coming on some little piddly podcast." And apparently now we are approved.
Yeah, well, we finally made it when we could get her the schedules to align to come onto our podcast.
So how's it going today?
It's great. How are you guys?
We're doing good. I'm actually looking forward to the show. Dietrich said you're going to try to embarrass me, and I was like, okay, bring it.
I was given strict instructions to make you as uncomfortable as possible during this entire production.
Yeah.
And being the fact that I really enjoy doing that, I took on that challenge and I'm going to run with it.
That's totally fine, actually. So I kind of want to start at the beginning. What the heck is a combat midwife?
That's a great question. So my background is training the combat medics and the flight medics for the U.S. Army. And I have been doing that for a long time. And the lovely combat medics came up with this fun name for me. And they said, well, you're a midwife, but you teach combat medicine. So you're like the combat midwife. And there may or may not have been, rubber bullets flying around the classroom while delivering a baby. That may or may not have happened at some point.
Yes.
Yeah, that is pretty dang awesome. So how'd you get into medicine?
So I have always wanted to deliver babies, and I've always been very drawn to medicine. In fact, I don't think my mom knew what the heck to do with me because I asked so many weird questions. So she just got me a library card and let me ride my bike to the library because we're older and we didn't have the internet. So
Yep.
I've always been really intrigued in medicine, and particularly just the reproductive nature of humans and animals and the whole thing. I really enjoyed lining up my baby dolls and my Barbies, delivering babies in my room. That's kind of how it all got started. And then I had to make some big decisions about where I was going to go to school and if I was going to go the physician route or if I was going to go the nursing and then the midwife route, or what was I going to do? And I got really nervous because I'm just super A personality, and my notes have notes. Like you should see my Post-it notes, like they have Post-it notes. So just super A personality. And I really wanted to make sure that I was getting into something that would have quality of life and I'd be able to pay my bills and have family life kind of balance. These are big decisions to make when you're, 17, 18 years old. And I really thought I was going the doctor route. That's really what I was geared towards, and that's what I was doing for school. And then I just kind of had like a mini panic attack on what I was going to be doing regarding schooling. And I had uncles that were in the fire department and, were EMTs. And I had just a group of family members that just said, hey, maybe you should try this whole EMT fire thing. If you can do that, then you should be able to do anything. And I went, that's probably a really good idea, because I knew that it wasn't going to be until the end of my 4th year of medical school that I would ever see blood. I would ever see a patient. And that panicked me. Like, what if I got through all of that and then went, not really my thing, $400,000 later to go, oops, is a big mistake. So that's my senior year of high school. I jumped into the fire department and became a firefighter and an EMT. And then I just really fell in love with that. And I really enjoyed everything that brought. Like, I liked the camaraderie and I loved the teammates and just everything that kind of brought about. So I was doing a lot of different stuff regarding fire and EMS. And then I was given an opportunity. I got a phone call and I was given an opportunity to come take a job interview at Fort Sam Houston in San Antonio, where they teach the combat medics. And I just was given an opportunity to come take a look at what they were doing, because we had gone to war. And what was happening is they were sending them out faster than they could train them. And they were reaching out to specific civilians throughout the country to say, hey, we need to put together a team in order to be able to teach these individuals. I have a pretty solid rule on I never say no to an interview ever, because I think that it's a really good opportunity. So I had no idea. I had no grandparents were in the military, but I had no experience to that whatsoever. And I went, military, sure, we can play, whatever, I'll try it. So I showed up and it was an awesome interview experience. They hired me and said, can you start tomorrow? And I was like, sure. So we jumped in head first. We just had a big problem. We were having just a lot of troops were being sent over, and they just didn't have enough people to train them. So that's kind of where I got into the combat medicine side of things.
Dang, that's pretty crazy. What were you guys teaching in the beginning there?
So the combat medic program was at that time and still is broken up into 2 sections. And so the first half of it is EMT basic. They do that in 8 weeks with a 0 week. So really it's 7 weeks of EMT training to include your national registry tests and everything in 7 weeks. That's pretty intense. Now they are going to school from still doing things like marching and getting woken up in the middle of the night to polish rocks and things, it's not, it's not the funnest time to be going to school. And then the second half of it, so the other 8 weeks is going to be combat medic specific. So, they're doing, how to load and unload a patient from a helicopter, chest tubes, IVs, blood products, just kind of the overall combat side of things. I kind of try to explain combat medics as a little bit of PA, a little bit of nursing, a little bit of doc stuff, a little bit of surgery, and a whole bunch of EMS smushed together is really kind of the big fundamental kind of platform, because they just kind of pilfer the needs trauma-wise of what they're going to see and be experiencing in whatever demographic, whatever area of the country, the world they're going to be in.
That sounds like a fun job.
It really does.
It was a really fun job. Yes.
Yes.
Really fun job. Yeah. So from there, I moved on to finishing up my midwifery education. And while I was doing that, and I also moved on to basically get my paramedic. And then I also moved on to teaching flight medicine, and that was really cool. So the military contracted with a local university at the time, and then they basically worked together hand in hand to teach a paramedic program in 6 months. And then from there, they did another 3 months, and they knocked out critical care paramedic and flight paramedic, which is stupid insane.
I can't imagine. That's a lot.
Yeah, in a very short period.
It's an extremely short period of time. I mean, even doing paramedic in 6 months, I went to the university that the Army was contracting with. So my paramedic program was in 6 months, and that was it was insane. It was hard. I mean, I would do it again in a heartbeat, but I'm a nerd, so I really enjoy school. So, but it was just amazing. I mean, it's amazing. It's a great program. It's very, very intense.
Yeah. And you're coming out of there with a ton of book knowledge and can't figure out how to get to your hands. You're like, all right, so now you need the real world experience. So
Yeah, it is a ton of book knowledge. And then I feel like we did a lot of really good hands-on. They do their write-outs with the local fire department, the city fire department in the area. They're doing amazing trauma stuff at the university hospital. I mean, the university ER is so big. I would lose students sometimes. Like the ER is just so big because I have to kind of make sure where they're all at. And I came around the corner. I'm like, oh, we'll wait for you for lunch. You look a little busy because they're like doing carotid massage in a trauma bay. And I'm like, we'll be around the corner. And when you're ready for lunch, you can come find us.
Just wash your hands first.
Just wash your hands because that's nasty.
That's nasty.
Oh. Man, that is so much. That is a ton. What was the time period you did all that over?
So I started with the combat medics in 2003, and then I was done with the flight medics in 2016.
Yeah, that's just like lots of learning for a very long time.
Yeah, it's super fun. I mean, I really enjoyed it because I was also having to learn that whole time as well. I mean, I had to kind of change, the military does their own research, and then civilian medicine does their own research. You have to implement both of those into the classroom to keep those students like constantly up to date.
So I have actually or just maybe this is a dumb question, but TCCC, like, did that ever factor in? Is that what you guys kind of teach these days, or is it something completely separate?
Yeah. So yes, it is incorporated into their education. They're probably, I'm not in the classroom right this second, so I can't say what they're doing right this moment, but they definitely do incorporate that for sure.
Okay, that makes sense. And since they're combat medics, they probably get TCCC for MP medical professionals.
Correct.
Which is the cool version of TCCC.
Nice. Yes. Then you get to go play out in the field, and then they shoot at you, and then you have to go save your friend.
Yes.
On a helicopter. Yes. Super fun.
That's the fun one.
That's not a bad day at work.
No, it's pretty cool. I loved being out in the field. That was probably one of my most favorite things. I mean, July in Texas pretty much sucks, but overall, being out in the field is probably one of my most favorite things, whether we're doing CBRNE stuff, or we're doing TCCC, or we're doing whatever at trauma lanes. It doesn't matter. That's a lot of fun because you're actually like taking all the schoolwork stuff and then putting it in action. It's always the best.
So awesome. So on your Instagram, CombatMidWife, obviously the midwife being kind of a big thing that you do. I did want to definitely touch on, we have a lot of civilians that listen to this show and just kind of pick things up. But, from the midwifery perspective, like, what are some things that people should know, should understand, important skills? Just like we'll start unpacking kind of all that, I think.
Okay. Oh, where do you want to begin?
I know. Let's just start at, how do you see this transitioning to civilian space? Like, what are things that civilians that could be faced with a situation should know?
I think first off is that birth and pregnancy in general is a normal function of.
It's nasty. There's nothing magical about it. Oh, sorry. There's nothing magical about childbirth. Like, it's gross. Like, there's stuff flying everywhere. There's fluid coming out of places.
There's profanity. It's like, we like shooting.
Yes. I'm like, this is so. Sorry to interrupt you there.
It's a normal function of life, of a woman's body. Like, we are physically meant to procreate, which means I know how to do that. My body knows how to do that. Can weird things happen during pregnancy? Yes, absolutely. But like any other bodily function in your body, whether we're talking about the pancreas or the liver or the GI system or the brain, most of the time human bodies know how to do things like thinking and oxygenation and carbon dioxide exchange. They know how to do those things. Can weird things happen? Yes, they can. But overall, 90% of birth is going to be non-complicated and non-emergent. And those are not combat midwife statistics. That comes straight from the World Health Organization.
Amazing.
So you're just there to catch the baby. Don't drop the baby.
I recommend not dropping babies.
If you do, I always tell my students to fake a seizure. Like, if you do drop this baby, then you fall on the floor and act like you had a seizure, and it's all good.
That's wonderful.
That's what I teach my students.
I'm going to use that for everything from now on.
If you,
Screw up, fall down, pretend like you're having a seizure.
yes.
Okay. Those are good techniques, but we could just not drop the baby.
I mean, okay, whatever. But yeah, that's true. All right, so childbirthing is perfectly natural and a beautiful thing, and you were going to tell us kind of things that we should understand about it.
So, you want complications? Is that what you're asking me now?
I think actually what I'm trying to ask is, I am walking down the street and I come across a couple in a car, and she is clearly in labor. Go.
Okay. Well, I would want to know how far along she is. I would want to know if this is the first or the second or third pregnancy.
She's 9 months. This is her 5th child.
Well, you better be ready to catch, because they just kind of fly out
Yeah,
there.
there's not a whole lot of resistance there.
There's no resistance anymore.
So once the reason people ask how many babies someone has had is because once a pregnancy has happened, normally the body goes, oh yeah, that thing, you want me to do that. And so there's not this kind of like tug and pull of trying to keep homeostasis, which is what the body's constantly trying to do all the time. So when there's a new pregnancy and it's the first time she's ever been pregnant, the body is going, wait a second, hold on. You've suppressed my immune system, you stupid progesterone, and you have told me to keep on, like, hold on to this whole nother unit that's pilfering things I've acquired. You know, it's taking my vitamins and my minerals and my protein. And okay, so don't get rid of it, keep it. But you dropped my immune system, and it's a lot. It's a lot for the body to go, okay, what am I supposed to be doing? Once a second pregnancy happens, the body goes, oh, I remember how this went and it ended okay. I'll do this again, right? So that's kind of the thought process of, like, once she's had a baby, it's typically easier the second time, third time, fourth time around, because the body understands. A lot of people attribute that to maybe elasticity of vaginal tissue, etc. That stuff goes all the way back to normal. Like, that's,
thank gosh,
goes back to normal.
Does it?
I knew this was about to get weird. Everything goes back to what it was prior to delivery. Like, even when I take care of a mom and then I come back the next day to, check on her and look at things like tears or sutures that I placed or anything like that, I can barely tell, looking at her anatomy, that she had a baby the day before. Like, things just go back to normal because we're supposed to do that.
Yeah, so we kind of question, like, is it your first? Is it your fifth? How far along are you? Clearly, I can see the top of the baby's head right now, so I don't think we have time to get to the hospital. And then
right. So you want things that are going to keep the baby warm, and you want to make sure that mom is in a position that is comfortable for her. Usually having women in an upright position, whether that's a supported squat or she can squat on her own, is a really great position. American westernized medicine really likes women flat on their backs. That's not really conducive to having a baby. You're working harder, not smarter. And that's really difficult. It's hard on us. If she's really, really exhausted, I would recommend rolling her to her side. And we always like women on their left side to increase proper blood flow through the body in an easier, less constricted way. So that's helpful.
I was going to say just, typically from like the third trimester on, if you have a female patient, have her laid to the left side because they can get their blood pressure can bottom out. They look like they're in shock. They look really nasty. And all of a sudden you roll them back on the other side, you get them to sit up and their blood pressure comes right back. So
correct. Yeah, absolutely. That's one of the other reasons I like to have women up on like in an upright position. If you look at historical artifacts, and whether it's drawings on a cave wall or if it's pictures, it's always depicted as women standing or squatting or on a birthing stool. So those are ways to position mom. And the reason that we're doing that is anatomically her pelvis. So my pubic bone is hinged. I have cartilage in between my pubic bone. Y'all have hardly any or none at all. It's fused. You're not having a baby. Yeah. So mine kind of hinges. So the other part of that is the coccyx bone comes around and it curves naturally like a baseball glove, right? Which is kind of a perfect place for a baby head to sit. And if you have her on her buttocks, then that's going to scoop around that baby head. So now baby head has to go up and over a coccyx bone, but also dip under a pubic bone. And that can put babies into really funky positions that make moms have to work harder and stronger to push a baby out. So if we're in the car, I might have her push forward to the edge of the seat, maybe open the door. I might have her push forward to the edge of the seat. If she needs some support, I totally get it. It's exhausting, like they call it labor for a reason. So I might have her maybe brace herself and push up off her tush. In between contractions, if she's just exhausted, then fine, sit down. I don't care. But when she's actively pushing, you just want them up off their tushy. The other thing I would do is you need something warm for that baby when the baby comes out, but mom is the best thing to warm baby up. A lot of people don't know this, but mom's temperature actually goes to kind of a low grade fever when they have a baby. And the reason it's a two-folded, so like survival mechanism. One, I have to warm this naked, wet, bald thing. And the second part of that is
purple monkey.
Sure. And the second part of that is the fact that I have a large gaping wound, right? It is warm, it is dark, and it's moist in there, and I'm bleeding, right? So the last thing I want is that's a habitable place for microorganisms to grow. So if I can jack that temp up just a little bit, I can subdue microbes from growing and hibernating, inside of me. So keep babies and moms together. The only time I think you should separate moms and babies is if you needed to resus the baby or if mom was a patient. Otherwise, they should always be kept together.
Dang. Warm,
never
bleeding sounds like a good Friday night.
For me.
It's like we like shooting show. This is a different show.
I know. I'm like, oh, you're going to embarrass me? No.
So that was my first delivery in the field. Was a mom
that's cool.
in a passenger seat of a car. It was, I don't remember how many kids. It was not her first go at this thing, and it was my first go at it. And I was like, holy cow. So I delivered a baby in the front seat of a car. That was my first one in the dark. It was not fun. But yeah, been there, done that. And the boyfriend, husband, whatever was like, who's going to clean the mess up out of my car? Not me, brother. Like,
yeah, no.
Sell this car. Like, I'm not doing that.
It's literally, here's a grenade, put it in there and walk away. That's
and then, like, I've been told, the two I've delivered in the field, we were not in a big hurry to cut the cord. Like,
right.
You're just like, in the movies, it's like, oh, I've done, snip, cut, and you're good to go. But like, we're taught not to be in a big hurry for that.
I totally agree with that. The big thing that, whether you're a medical provider or not, you should remember is that tubing from mom's placenta, baby's placenta to baby is the fact that they're getting oxygenation from that placenta until the baby says, oh man, I got this whole earth side thing down. I don't need you anymore. So until that hormonal information gets sent from baby's body to the placenta is going to keep doing its job, which is to send baby oxygen. So even when I resus a baby, I keep them attached to their cord. I do. I'll resus a baby in between mama, attached to their cord, because they're going to be getting basically passive oxygenation while I'm bagging them and doing chest compressions and stimulating and warming and all the things that I need to do.
Dang, that's pretty awesome. So let's see. So we've got the squat is a much more natural position if possible, or at least vertical to the best of your ability. You mentioned contractions. How does just the everyday layperson kind of explain contractions? It doesn't have to be like a big, huge, long thing, but how do we know when the baby's getting close?
Great. So contractions are the actual uterus squishing the baby on top of the cervix, which is the lower portion. It's the lower 1/3 of the uterus, and it is going to make the baby's head or other presenting part like buttocks push on that cervix to efface it and dilate. Efface is just fancy for getting thin, and dilate is to get bigger, right? So when that contraction happens, it's pushing baby's head on that cervix, dilating that, and then pushing baby down the vaginal vault. We time them on length and duration, right? So how close together are they and how long are they? So in order to know how long a contraction is, you count from the beginning of one contraction to the end of that contraction, and to find out how far apart they are, you count from beginning to beginning. So beginning of one to the beginning of the next. I have a 4-1-1 rule, meaning I want a contraction that is lasting, basically that is 4 minutes apart, lasting at least 60 seconds, so 1 minute, for 1 hour. When you have that, then you're in active labor. That's basically, don't call me before then.
Okay, that makes sense. What about, like, everyone hears about like cutting the perineum, which is that skin between the two pieces, to ease the baby.
The vagina and the anus, yes.
Yes. I was like, should I say that? No, she can say that. That's probably not a thing anyone ever does in the field unless they're trained to do so.
Right. So I will tell you that I've been a part of over 200 deliveries, and there's only been 2 times I've ever done that.
Okay, so I'll put the switchblade away.
Yes, please don't cut perineal tissue. On both accounts, it was because if I did not get baby out soon, I was concerned about a hypoxic event. So I was concerned about the baby's oxygen being too low, that I might have that baby be at risk for neurological deficit. So under any circumstance like that, that makes sense. But to speed up a labor, to get a baby out faster just because, all of that is not a proper reason to do an episiotomy, is the proper terminology for that. So in fact, it's a dying skill. We don't do that anymore. It was very common in the 30s through the 60s because of twilight sleep, which is just historically a way that they would basically take RSI medications for those that are in privy to that, and knock out a mom, to then cut a very large episiotomy all the way to the anal tissue, and then use forceps to pull a baby out.
Yeah.
So yeah, extremely gruesome. As a midwife and as a newer trained medical professional, right? I'm younger than most OB-GYNs. The process is that to let a woman tear rather than to cut an episiotomy. And the reason for that is because if you think about it, if I was to cut your arm and then I put a lot of pressure on it, it's gonna tear open even more, right? Because I've compromised that tissue. But if there was a lot of usage of that arm and that skin was intact, the likelihood of it tearing is still high, right? Because we've got something that happened to it, but it's going to be much smaller and more controlled, because the integrity of that skin is intact because there isn't previous damage to it. So the likelihood of cutting an episiotomy and then pressure because baby's coming out causing more damage is high because of the damage to the tissue. But as lay people in the field, we would not need nor want to cut an episiotomy for legality purposes, but then also because an intact perineal tissue actually suctions out the amniotic fluid from baby's mouth and nose and lungs when baby is born. And we want that to happen. And in fact, I very rarely ever suction babies with the bulb syringe post delivery because of that.
Dang, interesting. So what are some complications to watch out for here? What are some of the things that can go wrong that we haven't already covered?
So prenatally, the big things I think about are weird bleeding situations and then also blood pressure. So blood pressure is something very important to pay attention to. So for the men out there that enjoy their guns but love their wives and girlfriends and such and might be expecting a little one, the thing that I would say is just to watch signs and symptoms of high blood pressure. So whether that is a number, we don't have to learn anything new. It's just anything above 140/90 is considered high blood pressure for a pregnant woman just as well as a non-pregnant person. So we don't have to learn anything new, but other things like visual disturbances, seeing spots, dizziness, and excessive weight gain. And I'm not talking about she pregnant so she gaining weight. I'm talking about like she's got sausage fingers and toes and pitting edema around her chest area and face looks really swollen. Kind of just think of like the Oompa Loompa guys and girls, but like she woke up that way.
Eesh. Yeah, that seems awful.
Yeah, so that's toxemia or preeclampsia, and that is very serious and needs to be treated immediately. So those are like straight to the hospital, go get some help.
Okay, got it. I think that's awesome. Now, how does this change like care under fire or direct threat? Like, I mean, that's probably not a situation anyone would ever be in, but it's an interesting thought exercise at least. I mean, clearly scene safety is going to be your top priority, gaining the advantage over any kind of threats. But you mentioned earlier rubber bullets flying around a classroom where they're delivering somebody. Let's just spend just a couple minutes talking about that.
Well, yeah, I mean, and anything is possible. I mean, we live in a pretty interesting world these days, and absolutely anything is possible. I mean, we've heard in the news in the last few months of like, I mean, there was a pregnant woman who defended her boyfriend from a break-in and shot the intruder. Yeah. That could have gone really bad. Like that could have been horrible.
Yeah, with an AR-15, I think.
Yeah. Did we lose Dietrich? Do we need to pause?
No, he'll come back.
Okay, I'll just keep talking.
Yeah.
Okay. So that could have been horrible, and that could have gone a different route if they were not prepared. I'm so glad we're talking about babies, boobs, and bullets.
Exactly. The 3 Ps.
The 3 Ps. So for me, I think that we should be prepared. And that's why I love what I do so much with training, is that a lot of people kind of forget about female health and the fact that it could go really weird. So we could have a woman with trauma, with whether it's stabbings or gunshots. 8% of pregnancy can become or at risk for trauma. And it's usually motor vehicle accidents that can cause things like placental abruptions, where the placenta prematurely detaches from the uterine wall. It can also be things like falls. Falls are another real big problem. I mean, pregnant women haven't seen their feet for 6 months. Like it's you have an unequal balance of center of gravity. It's not an uncommon problem. So those are some things that can happen. But if you really want to talk, zombie apocalypse, the best thing to do is you have to always make sure that your scene is cleared first, right? Like I have to get to a safe place. Otherwise, as the designated provider, right, caretaker medically for people, I'm not going to be any help to anyone if I'm the one that's also shot up.
Yeah, totally makes sense. Let's change gears just a little bit and talk about like maybe some survival stuff. Zombie apocalypse happens, the boogaloo kicks off, the big igloo, like whatever it is.
Okay.
And so you're kind of living in the mountains with your mate, and I'm speaking for myself here with my girlfriend.
Sure.
Gynecologically, like what are the things that I need to understand as a survivalist or a prepper or something?
So big things are common female infections. So things like bacterial vaginosis, yeast infections, those are actually very common and can be quite a bugger to get rid of. They can kind of be annoying and they can hang around. The other thing would just be basic period care, so menstrual care. And then the other would be birth control. I think those are the big ones for apocalypse type stuff. I'll start off with, I guess, infections. So bacterial vaginosis and yeast infections are sometimes, unfortunately, can be difficult to diagnose unless you really know how to take care of yourself. There are many great female health orientated books, just natural ways to care for pregnant or for non-pregnant women as well as pregnant women. One of the best ways to take care of vaginal infections, non-pharmaceutical. So, we're talking, stuff hit the fan type thing, but the natural stuff that fight off infections, things like garlic, onion, turmeric, that kind of stuff, those are really great. In fact, I typically tell my patients when they call in and they go, I'm pregnant and I have a yeast infection. What should I do about that? I say a clove of garlic and just insert that vaginally and do that for 7 to 10 days will normally kill whatever the heck you've got growing in there. It's amazing, but it's easy. It's over the counter and it works. And if you can't go to CVS and you can't go get your normal take care of it stuff, or your body's not responding to that. A lot of women out there don't respond well to the chemicals that are in some of those over-the-counter medications. And it can cause more problems.
Yeah, that plus, garlic smells great too. So
yeah. Yeah, I'm gonna smell like garlic bread down there, I promise.
Oh,
terrifying. Are there some over-the-counter medications that maybe someone who's like prepping, just some survivalist stuff might want to kind of invest in and have on hand just in case?
Yeah, so I would think of things like, I would definitely think of anything that would take care of infections. So maybe some topical ointments and creams for yeast infections and bacterial vaginosis. When women are really, really stressed and when they don't have the ability to properly clean themselves, so things like showers and baths, and if we're talking post-apocalyptic US, that would probably be a problem. I probably can't safely go down to the river or to the stream to take a bath and clean myself without the risk of being exposed, right? So those are some kind of ways to think about that. I would think about things like how to take care of a menstrual cycle. I recommend to women to use menstrual cups. Those are super easy. They're silicone. They're medical grade silicone, and they're super duper easy. And there are so many on the market that are easy to utilize. So you use it repeatedly. You just rinse it off and clean it with soap and water, and you can reuse it through your whole menstrual cycle. You probably only need to replace them every 4 to 5 years, to be very honest. They're easy. There's no leakage. You don't have to worry about the strings. For the ladies in here, you guys know what I'm talking about. Just tampon strings get in the way, get caught on things. Pads and sanitary, like tampons, especially with disposal, right? So disposal would be a big thing in apocalyptic timeframes. You don't probably want a large quantity of blood sitting somewhere that attracts animals in the wilderness. So that's not a safe thing at all. So if you can control that and you don't have, sanitary issues, wherever you're going to the restroom already, you can kind of dispose of blood, and that would be an easy way. That's definitely what I have been suggesting to my soldiers that go overseas, because it's very difficult to to change a pad or to change a tampon. That's very difficult because now you're having to dig up and you're having to hide something like that if they're out in the field where, where you can just use a cup, and you can leave those in for 12 hours before you have to change them, which is great. You can do yoga, hiking, swimming, horseback riding, all the things, and you're not going to have any big issues. But you could pack a couple of those, especially. Another thing that a lot of men forget about is if they have daughters, like your daughters they might become women during that apocalyptic type situation. So you have to think about double, right? You have to think about how are you going to care for that side of it, as well as, you might have 2 women in the house if you have a daughter. So those are things to think about as well.
Definitely a good one. I have a question. So Monistat, they have Monistat 7, 3, 1, and I think that's the number of days it takes to become effective. Why would anyone ever buy anything but Monistat 1?
That's a very good question. So if you're familiar with the different types of antibiotics, I'm going to make a correlation. They are not the same type of medication, but I'm going to make a correlation. And that is, if you have a 1-day antibiotic, it means it might kill all the bacteria in that 24-hour period, but it might not. What's the other part? What could possibly happen is it could make the bacteria mad, and it could make them go, I'm now going to fight harder. So then what winds up happening, the patient has to come back into the doctor, pay another copay, and say, hey, I'm going to need something else. And now they have to do a 7, 10, or 12-day round of antibiotics. So I never, ever recommend anything less than 7 days. So I always tell women that if they have a yeast infection or bacterial vaginosis, you should always do at least a 7-day. That's why I really recommend an antimicrobial treatment, which would be something like garlic or onion or something along those lines, where you can use it as a suppository and just kill everything at one time. And it's super duper easy to do.
Dang. All right. Because I'm like, if I'm stacking away medicine just in case of, the boo-boo.
Yeah, those are things that I have in my prep area. I love using natural stuff first because it's easy. Probably in my garden or in my pantry already. I probably have it, so that's easy to do. But the other thing is that we're also happy that it's 2019, right? And we're excited the fact that I can go to CVS and I can stock up on this stuff, but I always recommend nothing less than a 7-day treatment.
Makes a lot of sense. All right. Skinny medic.
I had a question. We're going to go back a few minutes. So we talked about delivering in a standing position or squatting position. What do you feel like about the movement of delivering into water, like a bathtub, things like that?
So most of the babies I have delivered as a midwife have been in the water. Water birth is really nice for everyone involved. One, it's really nice for the mom because it's a pain management, as well as it's nice for babies. So they're transitioning from one water environment to another water environment. And then it's also clean.
Cool. And then we talked about, we're in the car and we see a head, which is one thing. But, very rarely, I know it is rare. What if we saw like a butt, like you talked about before, or you see a foot?
Right. So breech delivery is defined as either a foot, knee, or buttocks, something along those lines. Breech deliveries are not as uncommon as people think. And the earlier in the pregnancy she is, the more likelihood the baby would be breech, because it isn't until approximately 30 weeks that baby flips over. So most of the pregnancy, baby's upright. So if you have a really early baby that's going to be born, they're probably going to be breech. So breech deliveries, they happen. I've delivered breech babies. I probably don't breathe the whole time until that kid comes out, just because it is a little funky and it is a little weird, but it's a hands-off delivery. So you should not engage physically with the baby until the baby has their umbilicus is showing. And the reason you're going to touch them then is to check the cord for a pulse. I usually pull cord out a little bit to get a loop, to get some slack. And then I can touch the cord and just basically see, okay, yeah, there's a pulse and it's above 120. We're rocking in the right direction. If it's not, I try to slide the cord over to an area that isn't getting really compressed, usually to the side. Like if you can get it to a baby hip, or if you can kind of get it like around a baby shoulder or something. Usually it's getting compressed on something, and that's why it's not going to have a good pulse. So that's why I like to get a little slack. And then you should just leave the baby alone until the nape of the neck is showing. Now, if the babies usually have their arms crisscrossed around them, and so usually what you're going to do is you're just going to kind of like get your fingers, and I like to put pressure, gentle pressure, almost like if you were tapping your loved one at a dinner party, and you're like, don't tell that story. Okay.
Sean gets that all the time.
I do, actually. I'm not going to lie.
So I just gently touch the crease. So if you've got the arms that are kind of getting hung up, which is not an uncommon thing, because if you think about it, you got elbows, shoulders, and then the baby head. So sometimes they get a little hung up, almost like they're hung up in their parachute cord. So if you just simply touch them nicely, they'll slide their arms in front of them, and they'll kind of crisscross them. And then it'll be their arms hanging out, and then their shoulders will be born, and then their head will be kind of there. So once the nape of the neck is out, then you wait, and you just wait for about 30 to 45 seconds. If the baby does not come out on their own, then you're going to do what's called the Marceau Smelly Vite maneuver. Look, 3 French doctors came up with it. Jack Wagons couldn't decide who the heck was going to get the name. They hyphened the crap out of it. I have no control over this, okay? But you're going to take 2 fingers around their face, and you're looking for baby cheekbones, so index, middle, and then you're going to take your index, middle around the nape of their neck, and you're going to find the 2 large occipital bones. It's the 2 bony prominence on the back of the baby head. It kind of feels funky, like, why does the baby have 2 weird bone things here? So once you find those, you're just going to guide baby out. What you're doing is you're creating an inline neutral C-spine position, right? You're just holding them neutral. And you're going to try to guide baby chin to chest, because when babies are born head first, which is the preferred method of delivery, they put their chin to their chest automatically to let the occipital bone be delivered. But in this case, they're hung up on what? Coccyx and pubic bone. So if you can just help them out by getting, say, hey, Junior, push your head to your chest, right? Then they'll come right out. It's really that simple. I know I'm making it sound like you're making a peanut butter and jelly sandwich, and it's not that big of a deal, but it really is pretty simple. Very, very rarely do breech babies really need any help. They just kind of come out on their own. It's just slower. I will tell everybody it is slower. It does not happen as fast. Kind of think of it like the difference between parking a car in, the normal parking slot or backing up a trailer. You're going to get it parked either way. It's just parking a trailer takes a little bit longer because you got to maneuver 2 parts. And in this situation, I have the whole body came out, but now I got neck and head I have to maneuver. And it's like parking a trailer in a truck. It's just a little bit different.
I'm going to use that, definitely.
I know.
It's a Jessica-ism, but you might use it.
I will give you credit for it when I totally steal it, but I'll give you credit for it.
Yeah. Skinny Medic, are you okay? You look a little pale.
No, I'm good. I had to leave for a few minutes, but I'm back. I'm good.
Okay, good. I just wanted to make sure.
No, yeah, I'm good. Whew.
Keep smelling salts for the dad in my pockets. So if I need to toss you one, I can.
That's
Okay,
funny.
And
So-
put a garlic clove as a suppository. You'll be fine.
Yes. So when you never mind. So when we were talking, you said my kits suck. What was that about?
Yeah, it was a big drama right before the show. We almost didn't record.
Yeah.
No, I said the standard OBGYN kits on the market suck. I did not say Skinny Medics shit sucks. Say that. I don't think that they're incorporating a lot of helpful things. I think there are a lot of fluff. There's a lot of extra stuff in there that just, especially like a lot of EMS and even civilian people. I mean, we're not typically delivering babies on the side of the road. So it's just a lot of extra stuff in there that you don't really need. You really just need a bulb syringe. You need a blanket, a hat, something else to suction them. I really like a Deli suction. I think those are really cool because it doesn't require electricity. It doesn't require a power source. And it's good for like mucus that gets kind of stuck in the part of their throat that a bulb syringe can't get to.
What was the old school one that you had to suck on?
That's a Deli.
Yeah. Oh, that's it. Okay. I'm like, oh, yeah. Yeah. Okay.
So it's creating a suction by you sucking on the part that goes in your mouth, but it's a one-way valve. It's just creating you're just creating a pull like your electronic power sourced suction would work. And I like those because if you're thinking about, shit hits the fan type situations, or if you're thinking about weight, some of you are making packs because you're trying to travel somewhere or go, like it's important to make sure that you don't have a lot of weight. And some of those handheld suctions take up space and weight, and that's ridiculous. And they don't fit in babies. So bulb syringe, a Deli, a hat, a blankie. You need something to clamp the cord if you are going to cut and clamp the cords.
Only a cat tourniquet does it.
A cat tourniquet won't do that. Yeah, not going to work because that's a 5-inch diameter.
I bet a rat would work.
Yeah, rat's tourniquet may work. We might get a rat's tourniquet to work on that.
Tourniquet. So yeah, so you'll need something like that. So cord clamps are really great for that if you are going to clamp and cut the cord. And I'm trying to think of my other favorite things. Maybe a tinfoil blanket if you really think that you're going to be in an area where it's going to be really cold, or you're concerned about a baby not being able to control their temperature. And then other stuff to like take care of bleeding for mom. An ice pack is really cool for that, especially if she's like external genitalia bleed, because the ice is going to cool that, and that's going to constrict those blood vessels. Plus, it feels great. Moms love it.
Don't wound pack it.
No.
Don't pack the wound. Don't be a knucklehead.
Oh man, this is so much to like digest, and I think honestly, like for a lot of the preppers and survivalists out there, like this is not a thing that people spend a whole lot of time thinking about, and it's great to discuss something that I don't even know why people don't think about it. Like I have 4 kids, I have been a part of every part of this process, and I've seen things that honestly, no man should ever have to see. But I think it's so often overlooked. Now, Skinny Medic, I know you do sell kits, and you said you actually sell quite a bit of them, right? So people are thinking about it.
We do. Like we have the Dynarex OB kit, which is basically the kits on every single ambulance in America. And, midwife is correct. Like the 2 I deliver in the field, like we didn't use half the crap in there, honestly. Like I used the blanket, I used the cord clamps, and I used my EMT shears. I didn't use the scalpel to cut the cord. So, and we wrapped the baby up. We took the baby to the truck both times. We've kept it nice and warm and things like that. So, no, like we really didn't use a lot out of that kit. It's a big kit. It takes up a lot of space. Like you were saying, like most of the prepper crowd that we're, friends with and work with, they're not thinking about this. They're thinking about the gunshot wounds. They're thinking about all this other stuff, fish antibiotics, things like that, which, hey, whatever. But this isn't one of the classes. Nobody wants to talk about it. It's kind of awkward if Sean and I are just sitting here talking to each other about OB stuff. So, and so I think it's obviously if the crap ever hits the fan, that stuff's still going to happen.
Yeah, it is going to happen. And there are so many very easy over-the-counter things that you probably even have in your house, and you're like, wow, I didn't know that I could probably use that to deliver a baby or to clear up that infection that my poor wife has been struggling with for the last week. Or, they're just really simple things that a lot of people aren't really aware of.
Yeah, that absolutely makes a lot of sense. All right, so Skinny Medic needs to update his kits because they suck, according to Combat Midwife.
Well, I did say that he and I need to like team up and maybe come up with a GYN kit and then an OB kit. So
I think it's a great idea, and definitely something that I need to put in some of my kits. just in case. You never know. Like, I carry a gun every day. I probably will never ever have to use it, but just in case that day happens, I have it with me at all times.
Correct.
I think we're getting pretty close on time, but it's is there stuff that you wanted to cover that we haven't covered, or something you're excited about that maybe we should cover?
Something I'm excited about?
Yeah, like is there anything we've neglected to ask you about
Regarding birth and babies? I don't know. I think we did a pretty good overview of what to keep in your kit and what to look out for, without going too much into the medical stuff.
Okay, cool. And I'll cut that part out, or I'll have it cut out. I just wanted to make sure.
I didn't quite know where you wanted me to go with that.
Yeah, no. I was literally asking, did we miss anything? I mean, we missed a ton of things, but like for the kind of overview stuff.
Yeah, I mean, I could keep talking about. I mean, I don't know how far you guys want me to go on this.
No, I think the overview is good, and they can always. Do you teach public classes?
Absolutely.
Okay, so I'll ask about that as soon as Dietrich comes back.
Yeah, what's he doing? Does he just not want to talk to me? I mean, he's been bugging me for months about this, and then he doesn't even freaking show up.
I think his computer's rebooting or something. That would be my guess.
I'm really making fun of him because usually it's my shit that doesn't work. So this is fine.
My stuff works pretty great, but when my stuff fails, like because I'm in a big studio right now.
Yeah.
When my stuff fails, it's catastrophic. And it happens usually about once a month, where just some component somewhere under my desk on the soundboard, whatever, just suddenly stops working.
Oh,
tracking it down is so annoying. Let me see where he's at here.
Okay.
His computer just restarted on its own. Dang it. We'll wait for him to get back and then we'll cover that stuff.
Yeah, for sure. I have plenty of time.
And we'll cut all this junk out. I took a timestamp, so we should be good. I don't edit anything. I have an editor that does it all. So as long as I timestamp it, we're good. Some of the pictures on your Instagram are hilarious, like the birthing dummy with the flip flops on.
Thank you.
It's awesome.
Yeah, we dressed her up. That's the recertification class for the Army. So now I kind of do more behind the scenes. Like I'm not in the classroom every day, and I'm kind of doing more recertification and pre-deployment training than I am doing initial education. And so that's the recertification class for the flight medics. That's taught every 2 weeks. And I was there for a section of time, and they kind of tasked me with OB-GYN, and it was funny. I was like, well, I'm going to dress her up then.
I love it.
Yeah. You should, is that the picture where you can see their faces too? I don't know which one you're looking at, but
let's see.
You should, like, the looks on their faces was just like shock and horror.
No, I can just see the one dude, but the rest of them are not.
Yeah. The rest of them are like behind me, kind of like in a half circle, and they're all just making these like weird, ridiculous faces of get us out of here. I need help.
Yeah. Skinny Medic was like, I told her to embarrass you. I was like, dude, I have 4 kids. 2 of them are daughters. Like, I don't think I can be embarrassed anymore.
And then it was him that was looking queasy.
It really was. I love it. Did look a little pale, I swear. I was like, are you okay?
When he came back, I was like, sick. Well, he kept cutting in at like the most inopportune times as I'm talking about shoving garlic in your vajayjay.
I know. I actually have never heard that before. I thought that was awesome.
Thank you. It works.
That's amazing. I'm not even going to ask how you know.
Acidophilus works really well too. So you can use the gel capped acidophilus pills.
Really?
And I usually just do those, like about 5 of them. So basically like a small handful, and you just insert them like vaginal suppositories. And then you do like topical. I make my own kind of salve for my patients and for moms and stuff, but it's just things like calendula, coconut oil, olive oil, just a bunch of like astringent kind of antimicrobials, and they can put that on the outside for the itch and burn that is just horrific. And then go to sleep. So just put them in at night and your body will just kind of digest all of that probiotic stuff. And I usually have them do that for about 10 days with the garlic clove, and it's whatever's in there is dead. It's gone. You keep coming in at the most inopportune time.
And now he's on his phone.
I'm on my phone. This is ridiculous. My laptop decided it wanted to restart, and it says it's 35-minute update.
Oh my god,
that's wonderful.
And Candace has her MacBook here, and I was like, oh, I'll just log into it, and she's got me locked out. I don't know her password, so I was like, I guess I'll just get on my phone then. So here I am on my phone.
That's awesome. Hold it just a little closer so you're a little bit louder. It'll be awkward for. Okay, perfect. All right, so let me just take a timestamp here. 1:49.
Totally ridiculous.
Stupid computers.
we can make it work though, man.
Yeah, we got this.
Thank you. I'm glad Sean's able to carry the team here.
Basically, it was just the Sean and Jessica episode, and you just kept getting kicked out.
And
I told you guys I was going to be the third wheel. I'm like,
we just kept talking about anuses and Skinny Medic disappears.
Yeah, bloop, I'm out.
All right, so let's see. I think I'm gonna talk about, do you teach public classes? Where can they find out more? And then we'll wrap it up.
Awesome.
All right, so let me take
I'm
another.
going to have to go back and listen to this podcast.
It's really good. I think you'll enjoy it.
God.
You only say things 3 times in the whole episode. I think.
Yeah, I'm completely out. My internet, my router kicked me off, so I had to log on my router. There was about 10 minutes there where I was catching every other word.
Oh man,
this is stupid. So mad.
That stinks. I'm sorry, bud. We've been planning this for so long.
I know. It built up all this excitement, all this anticipation, and poof, gone.
Well, we have to spend more time making GYN and OB kits for your boxes.
Yes, I want to do that for real.
I do too. It'll be fun.
it will be. All right, here we go. 102.30. All right, so Skinny Medic's back. I think he had to go take a moment to himself. I don't know what's good. He came back looking all pale and on his phone, and I don't know. He's like,
they did not talk about this stuff in sex ed when I was in school.
Why are you sweaty?
Oh my gosh, this is crazy.
I haven't even covered anything birds and bees related.
Oh no.
Maybe that's the problem. Maybe we should have started ease me into this conversation, like birds and bees, and then
we just start off with when a mommy loves a daddy. Yeah,
one day I'm gonna go through puberty, and I want to know what these feelings are that I have inside.
My stars.
So, Combat Midwife, do you teach classes to the public?
I do. Whether it's EMS related or not, I have no problem coming to wherever the location is. I bring all of my own stuff, and we will run through all sorts of different scenarios. I also work with the military still, and I teach their pre-deployment and their recertification classes for combat and flight medic stuff. And then I also love to do the bridge between EMS and out of hospital birth. So for midwives, when they do need to do a transfer. So a lot of EMS agencies have reached out to me and said, hey, we had a really crummy transfer. How do we avoid that happening in the future? So I do that, and I teach at tons of different conferences throughout the year. So I travel a bunch.
That is awesome. Where can people find out about classes or get in touch with you to come teach a class or something?
So I have yet to say no to a class. So as long as someone just emails me, let me know kind of basically what their needs are. So number of people, what do you want to learn? And then I will put together specifically a class for that particular group of individuals. So I have cookie cutter classes if those are things that people want, but very rarely do I use those. I usually find out what the needs are of the organization, and then I custom build a class for them regarding their needs. it'll fit them better. So if I had a bunch of preppers that came to me and said, hey, we want to know how to take care of our wives and our daughters in, a shit hits the fan situation, then I would custom build a class for that. If I have an EMS agency that said, hey, we just had a really crummy transfer of an out of hospital birth, how do we make that not happen again? I'll custom build something like that for them. So it really just depends on what the needs are of the organization.
So
That's
cool.
awesome.
Yeah, that is awesome. Where can people get in touch with you?
So you can email me at ask@combatmidwife.com. You can also find me on Instagram, which is really fun because on Midwives, we do Midwife Monday. So my handle is Combat Midwife. On Midwife Monday, every Monday, I take a topic that is either something I'm passionate about discussing that has to do with austere, GYN, OB, peds kind of things. Or I have people that will message me and be like, hey, I want to know more about this topic. Or I had a call and it was awful. How do I not have that happen again? And then we'll discuss it. So it's either a post or I do a bunch of stories if I really have too much to say.
Yeah, the one that got me on that one was the Midwife Monday. You were like, are you part of the Mile High Club? I was like, what? Where are we going with this?
So something about me personally is I love shock and awe. I really enjoy shock and awe. So and it's a topic that is very easy for me to shock people on. And so, yeah, that was how to deliver a baby and you're in an airplane. And so I talked about the Mile High Club and everyone's attention was definitely honed in because you sickies were going a different direction.
Yeah, without question.
I mean, that's pretty much what all men think about, that and food. So we're good.
And guns.
Yes.
Yeah, actually. Yeah. It just so turns out that those are the things I'm most interested in.
Those might be the things I'm most interested in as well.
I love it. I love it. Thank you so much for joining us. It's been amazing.
Thank you so much. I had a blast talking about babies and boobs and bullets. So let's do it again.
And anuses.
And anuses and vaginas.
We didn't talk about anuses at all, you weirdo.
No, we did the episiotomy.
But not okay.
And you put a clove of garlic in there to combat yeast infection.
That was a vagina and not an anus.
Oh my God!
I did hear that part. I did catch that part.
Not the same orifice, y'all.
I need to fix my notes. Hold on. Right.
The garlic goes where?
I need to fix my notes. Okay.
This is like Combat Midwife cooking. Like, where do we put the garlic clove now?
I know.
Acidophilus and garlic cloves, not in anus. Got it.
Yes.
Perfect. All right, that'll do. Go check out Skinny Medic, medicalgearoutfitters.com. Coupon code Civilian Medical will save you 10% off the garbage OBGYN city has there. Just kidding. No, but there's all kinds of great stuff there. And you can find it every single day. Thanks for listening to the show. And thanks to Combat Midwife for being here. I will talk to all of you next week.
Find us and subscribe at civmedical.com.
Totally just screenshotted that.
Which part?
Oh, just his face like this.
We bored her.
Oh.
I think that was actually really fun.
I hope it was.
I'm glad you guys enjoyed it.
Maybe next time you can show up.
Maybe I can join the club next time. I'm like, good gosh.
I knew that you were having issues. The first time I thought your computer rebooted or something because you just like disappeared.
That's when it kicked me out because I was hearing like every other word and I thought maybe it's gonna fix itself. I'm just gonna hang in there and I'm like, Sean's got it. And I'll just do this. And all of a sudden it was like, bloop, you're out. And I was like, crap. So I was like, I'm gonna go restart my router, so I'm gonna get kicked out anyway. I'll just restart the router. And then I came back in, everything was good. And then my computer I remember seeing something pop up. I didn't read it. And it said, restarting. And it said 35-minute update. I'm like, oh.
Oh my God. Yeah, that sucks.
So then I went to Candace's computer and she's not here. So I tried all of our different like family passwords. None of them's working, which is an issue. we have like 4 family passwords, and none of them worked. And so then I was like, all right, I'm just going to see if I can log in from my phone. And then, ta-da, here I am.
Well, don't get mad at her because it is Christmas and she may have locked you out for a reason.
Yeah.
Yeah.
No, it's fine. Like, but my son gets on it all the time, so he knows the password. Maybe I should have texted him. I'm like, son, what's wrong with the password?
Denied.
I hope he's like, Dad, I'm not telling you that. That is.
Yeah, I've gotten locked out, so but it's okay. I'll go back and listen to the podcast in 2 weeks.
I love it. I love it.
Like, we should have you back on so I can get some more questions that I have now.
We could do that. Or do you want to, when your computer works, do you want to like revisit and we could just edit them together?
I'm trying to think. Honestly, though, there's not really much more. Like, I wanted to cover, like, I did have a question about the bathtub thing, which we covered that, and then the breach and things like that. So
yeah, I think we did cover those.
Yeah, like, honestly, like, I don't think I really missed that much, to be honest with you. But
yeah, no, I had a list of things I wanted to ask about, and we talked about all of the things on my list. We talked about all the things in the show notes, so I think it was solid.
Yeah, no, I think it was good.
I didn't go into depth on bleeding stuff, but I don't know if you guys care.
There's not a whole lot that the civilian medic can necessarily do, especially on some of that internal hemorrhaging.
Yeah, I mean, there's some cool tricks and fun things that they can get, but I mean, we can just add it to our box.
There you go.
Yeah, I mean, I like the ice pack idea. Like, I didn't really think about that, being honest with you. I'm like, I like the ice pack.
There's a bunch of different tinctures I use for postpartum hemorrhage before I ever use PIT anyway.
Yeah, that stuff's nasty.
Pitocin?
Yes.
For
Like, it's, huh?
For nasty for who?
For EMS. Like, we don't really like to use it if we don't have to.
Why?
Like, the ones that I've given it twice in the field, and like it's just a lot of the cramping. Like, it calls over.
Yes, that's okay. I was just trying to figure out where you were going. I'm so sorry. I wasn't understanding where you were going. Yes, that's why I like to use herbs for postpartum hemorrhage before I use Pitocin.
Like, the cramping it seemed to be like, obviously it was working, but like, it's caused more pain and more discomfort then. It's
not contractions of this world. I call them Satan contractions.
Yes. Do we cover like the placenta or something like that? Anything like that?
Mm-mm.
No.
You kind of you ditched us, and then we went a different direction on the birth. We went a different way, so you weren't there to like reel us in to back to the birth.
Come back. That's the only thing. If you guys want to cover that, like the placenta, talking about, it's going to be maybe, or if you think we're good.
Up to you guys.
I mean, yeah, we didn't really wrap up that birth, that birth in the car. So I don't know if we can.
Yeah.
My computer's back up and going, so I can probably fix myself again.
Yeah, log back in. We'll record that. I'll have the editor edit it in around the birth area.
Okay, because Bobby's still like 20 minutes out from being able to record for us. So we still got a few minutes to kill.
Okay, cool.
All right, I'll see you guys in a minute.
Okay.
Do you know how I don't know, can you go back and listen at all or no?
Yeah, I record everything through a soundboard to a thing.
Where did we leave? I don't know where we left off, because you and I trickled down a different path. And then Dietrich came back in and was like, what about water birth and breach? Right.
Let's see.
Him asking those questions is kind of like in a weird section, but I mean, I don't know if there's a way to go back and see like what we were talking about, or should we just pick up and then your editor person will just put it where it sounds good?
Yeah, we'll pick it up, and I'll go back and listen and tell her where to put it in.
Got it.
Sorry for the trouble.
No, not at all, man.
So I don't know. Maybe you can remember what we were discussing, Dietrich, regarding the birth, and then we can transition, because we talked. You were like, that was the birth. That was my very first birth. That's what I did, and then we kind of went down a different pathway, so we didn't really like wrap up on now the baby's out. Like, I talked about putting baby skin to skin with mom.
Yep.
Yeah, and I think we pick it up literally right there. I was just going to say that. Like,
okay, perfect.
I can come in there and talk about my two stories because the one, like, we hung out in the house and we delivered the placenta in the house because we were no big deal. The one with the mom, it was cold outside, so we did move her to the ambulance and we delivered the placenta delivered, on the way to the hospital. So I can come in and talk about that, and then you can kind of add your expertise in there.
Love it.
Perfect. All right, let me hit record. Okay, so we talked about skin to skin and the body raising its temperature and everything kind of there. But what's next?
So for me, like, I've delivered 2 in the field. One time was in the front seat of a car. It was cold outside. So after we delivered the baby, we did go ahead and cut the cord and move the baby to the ambulance because we felt like we could keep it warm enough inside of a passenger seat of a car. And then we loaded mom up and we took her to the hospital. And on the way, the placenta delivered, which was probably 30 minutes later, something like that. The last one I delivered was inside of a house. It was nice, comfortable. We had plenty of lighting. It was great temperature. So we were not in a big hurry. So we delivered the baby, put the baby on mommy's chest, hung out for a little bit, and then we delivered the placenta. And then we went to the hospital. That way my truck didn't get dirty, nothing like that. Everything's good to go. I don't think it's less mess for me. And we were kind of able to chill with mom and kind of hang out there for those first few moments. So and there's some crazy stuff that happens with placentas that they're doing now on both ends, like as far as like saving it or eating it. It's like there's all kind of crazy stuff going on. But it takes a while for the placenta to come out, right?
So it can take somewhere between about 10 to 60 minutes. On average, it's somewhere between 10 and 30 minutes.
And then what's your take on like what's going on with placenta as far as even like saving it for research DNA later, or are these people that are frying it up with scrambled eggs? Got her.
I cannot go through any classroom, podcast, anything without the eating of the placenta coming up. I just find it so funny. So
does it taste good or?
Well, I mean, I haven't had a baby, so I don't know what placentas taste like. I mean, it's not like we're sharing a bottle of OJ and a placenta.
People don't invite the midwife back for breakfast the next day?
No, you goofball.
Yeah, thank God.
So do you want to talk about delivering the placenta, or do you want to talk about making breakfast?
Yes.
Yes. Let's talk about first delivering the placenta.
Okay. So delivering the placenta is actually pretty easy. It usually comes out on its own. It will take some time for that process to happen because I referenced how the baby will send information to the placenta that says, I don't need you anymore. I know how to breathe on my own. Peace. And the placenta will just detach from the uterine wall and then become kind of maybe a little stuck, if you will, for lack of a better English word, around the cervical os. So the best way to deliver the placenta is that the mom has said, I start to feel crampy again, or she'll say something along the lines of, I don't feel good. It kind of is a feeling like you're getting the flu, achy joints, clammy, I just don't feel good type of feeling. And that's because the body says, hey, this is foreign and you ain't supposed to be in here, so you got to go. So that will happen. Another one is lengthening of the cord, and that makes sense to us because the placenta is up at the top of the uterus and then it falls down, and so the cord will lengthen. So you'll get, and then another one is detachment bleeding. So you just get a big gush. There's not like constant bleeding. It's just a gush of bleeding. And then you just, I always wrap my finger around the cord to anchor it because it's really slimy. And so if you can anchor it around your finger, it gives you something to hang on to. And there should be no tugging or pulling or anything. I tell moms to cough. And when they cough, you can't clench your perineal tissue. Try it on your own time, not during the podcast. You're going to loop it around and you're going to tell mom, cough, 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 cough. And then there will be a portion of the placenta that will be delivered. And I usually pinch it together like you were going to pinch together ends of your pizza, right? So you're trying to anchor it is what you're trying to do. So you're going to pull it together and then it'll just come right out. And I always tell moms, don't clench, no bones. And that will help them remember you're not giving birth to a baby again. It's just tissue. And that it's really simple, it just comes out. And then you look at it and you make sure there aren't any spots missing, because if there's spots missing, that means it's inside her and she's going to continue to bleed. And then you just save the placenta, because if you're going to the hospital, they like to make sure that everything did come out. And that is a really good inspection. You can do a quick inspection. The maternal side looks bumpy like a brain, and the fetal side looks really smooth like a tree of branches. It's quite pretty.
And then to back up one more second, just kind of thought about it in my head. Like, so we go to cut the cord, we want to leave a few inches there. You don't want to like cut the cord like right up next to the baby. Like you want to give a few inches, correct?
I always say that you leave much longer than you think that you need to. I mean, if someone's studying for an exam, there are specific parameters for testing purposes. But for real world purposes, I would much rather you have more cord than less cord. And the reason for that is because that's a lifeline in a hospital situation, or with the paramedics that come up. We can actually feed IV tubing through there, specific tubing to get a line, right? We call that an umbilical cord catheterization. It's super easy to get fluids, dextrose, epinephrine, whatever you need for baby into that cord. So that goes straight to their heart.
And then the only other really kind of emergency that I would think of that kind of freak people out would be if the baby comes out and the baby's not breathing. Maybe baby doesn't have a pulse, things like that. So we can't use a normal bag valve mask because it doesn't fit the face. So having that neonate, that smaller mask size is important. Understanding that the lungs are super small. So it's almost like you're burping the BVM just to get enough to get chest rise. But oxygenation is super important for these little.
Yeah, so to put it into perspective, if you've ever made water balloons, right? The little teeny tiny balloons that you make water balloons to play with your kids in the backyard, or grown-up adults, big kid adults that want to play water balloons, that's how big baby lungs are. That's not very big. So you're really just getting small puffs. And when you are delivering those ventilations, for some weird reason, something happens in people's brains that when you think small puff, you think fast. And you need to make sure that you're not ventilating so quickly that you rupture that itty bitty little thin water balloon lung. So again, chest rise, chest fall is what you're looking for. And you're looking for a range of somewhere around 40 breaths per minute is really what you're looking for.
Oh, wow. Because adults are 12 to 15, right?
Yeah, newborn babies are 40 to 60 breaths per minute.
And then if we are doing chest compressions on a neonate, that our chest compression ratio is a little weird there, correct?
So we're still looking for that between 100 and 120. So the rate that we're looking for is still the same as an adult. The heart rate range for a newborn baby and an infant is between 120 and 160. So super duper fast. But any heart rate less than 100, we need to ventilate. And any heart rate less than 60, we need to do CPR.
And doesn't like the chest compressions with your BVM, like is it 5 to 1, 3 to 1, doesn't for the neonate?
Yeah, so we're looking for a 3 to 1 kind of ratio basically is what you're looking for essentially. But really, I like people just to focus on proper chest rise and fall and proper chest compressions, right? If we start getting it's already a stressful day if you're doing CPR on a baby. Already a crummy day. So when people start kind of nitpicking numbers and they're freaking out and focusing on numbers, their quality tends to be poor. And it is not an uncommon version of normal for babies not to come out breathing, which is why I referenced earlier that as long as they're still attached to their cord, they are still getting oxygenated. They're not ventilating, but oxygenation and respiration is taking place. You just need to realize it's going a different route. So it won't be until that baby takes its first real big deep breath that those extra valves in the heart close anyway, which means they're under fetal classification of circulation until that happens. So try not to panic and remember that they're getting oxygen. It may just take them a few minutes. They're transitioning from being an underwater creature to being a land creature, and it does take some time.
No, the one child, like the APGAR score was kind of low. And that was the score that we used to tell how well the baby's doing. It was not super low, but wasn't super great either. And I remember calling the doc on the phone, going, "All right, my APGAR score is this. What do you think?" And he was like, "It's a 1 year. It's 1 minute old. Dietrich, calm down." So I was like, "Okay, doc, this is my first one." Like, and he's like, "No, this child has been in the world 3 minutes. Let's warm it up, give some oxygen, and be careful." And so by the second time rolled around, I was like, all right. By the time the first one I delivered in the field, I had no kids at the time. Now the second one I delivered in the field, I had 2 kids. So I kind of was like, all right, man, this is my 4th child I've seen come in the world. I can have this. And my rookie partner was the one freaking out. I'm like, no, it's no big deal. We got this. We're good. So much more calm with experience coming there.
Yeah. It's just not uncommon for them to come out needing a little assistance. And sometimes that assistance gets misinterpreted as we need to breathe for them and do those types of things. And sometimes it's just positioning them, stimulating them, warming them, and drying them. And when you focus on those key elements, it's going to render you with better APGAR scores that are just baby SATs anyway. I mean, most people don't score really well the first time they take the SATs. And that's kind of the thought process with babies. The first time they get their APGAR score, it is only at 1 minute old. I mean, they're still trying to figure out, I have a hand. That's cool. They're still trying to figure out a lot of stuff, and it's okay. But really, we want an APGAR score of 8 or greater by the 5 minutes. And if it's not, then we take an APGAR score every 5 minutes until it is 8 or better. But that's not something we need to really worry about as civilian providers. Really, we just want to be breathing that is pink, right? And has a good heart rate. And if you have those good 3 things right there, you're probably an APGAR of 8 or greater anyway. So I really, even my brand new medics, my baby medics, I tell them all that all the time. If you got a breathing baby, a baby with a heart rate, and they're maybe doing a little fussing or a little crying, you're probably great.
Love it.
Awesome.
I think maybe we will revisit some bleeding right now. Like what kind of bleeding do we worry about in mom, and what do we do about it?
So postpartum hemorrhage is the #1 killer of women in first and developing nations combined. It is actually pretty serious, and it can be something that gets accidentally overlooked. And it's overlooked accidentally in a hospital setting, in pre-hospital settings, in rural areas and urban areas, because there's 2 patients. And anytime there's more than one patient usually gets forgotten about unintentionally. It's human nature. We don't actually multitask very well. So when we have 2 patients, it can sometimes get overlooked. So one of the things to control bleeding postpartum is to keep mom and baby together. I really don't care if she wants to breastfeed or not. I mean, I actually do care as a midwife, but I mean, I don't care right that second. But if you can get baby's face anywhere near mom's areola, that there is hormone exchange that happens there that will tell mom's uterus to clamp down. So that's a big one. So keeping them together as a unit. Also avoiding any sort of manual manipulation of the placenta and not removing it prior to its designated time to come out. I do want people to know that if she's not hemorrhaging and the placenta hasn't come out in a specific time frame, that not to panic, because placentas can stay in and nothing bad is going to happen to mom. Like there's not like this magic time limit where all of a sudden everyone just, poof, everyone dies. Like there's nothing. bad that's going to happen to mom if that placenta stays in place. So if you're struggling to get that thing to deliver, go to the hospital anyway. They'll help you there. And then if bleeding is occurring, you can do some gentle massage to the fundus, which is the top part of the uterus. And the fundus should be located at or below the umbilicus post-delivery. If it's higher than that, then there's two things. One of two things is a problem. She's either bleeding internally or she has a full bladder. Usually bladders will cause uteruses to be higher than they need to be. If you can get her to pee, usually that uterus can clamp down. A lot of people don't understand that the uterus and the bladder are stuck together like a really awesome Oreo cookie. So if the bladder is full, then that uterus is not going to be able to clamp down because it's got a blockage, right? It's got something in front of it. And the bladder just got punched in the face with a baby head. And so it's stunned and it has a hard time releasing. So usually I just slip a Chuck's pad under her and go, I'm going to turn around, pee on the Chuck's pad. Like, because nobody can pee when being watched. Like, you can't do that. We're not, we're not deer in the woods. So usually I just say, hey, just pee on the Chuck's pad, or can you get up and go to the bathroom? And then usually that uterus will clamp down. If it truly is a bleed, then massaging the fundus is really helpful. And you're not making bread. You're not kneading dough. Okay, you just need to do some gentle massaging. Again, when the uterus is really tired, it becomes very floppy. So if you can kind of just gently massage it, it's like if you had a knot in your shoulder. If you push too hard on that knot, it hurts. And what does your muscle do? It spasms up even more. So you want that kind of bliss spot of making sure that you say, hey, stop, and release knot in my shoulder, which is what you're trying to get the uterus to do. Hey, remember your job when a baby comes out is to clamp down. So as soon as you just kind of give it a little bit of massage, it usually clamps down. If she's really, really bleeding horrifically, then bimanual compression is another way to handle bleeding postpartum. But that's when you push on the fundus with a fist and then internally, and you push those fists together. I'm talking about she's got copious amounts of blood. You're really thinking this is not a good thing, and you can't get the placenta out, or it still is in, or there's just lots of blood, then you want to make sure that you stop it. And just like you would stop a bleed on your arm or your leg, you're going to put pressure on that. And that's the same thought process there. There are some over-the-counter things. So if you want to stick some stuff in your cool guy kit and cool gal kit, you can get some herbs, things like blue cohosh and false unicorn root, and just a bunch of other really awesome tinctures that are easily, you can buy those over the counter. For some really great, like Wish Garden Herbs is a really great place to get those. They come in little tincture bottles. They'll be good as long as you keep them in a cool, dry place. They'll be good for years and years and years. And those are going to be uterine tonics that will make a uterus contract. I usually, with my midwife hat, I use those way before I ever use Pitocin, and they work. Like, they'll stop a bleed like that. They work.
You said false unicorn root. I don't even care if it's useful. I just want some.
Just so you say you've got it.
Yeah, I'll be like, hey,
yeah, it's the name of the herb, but blue cohosh works.
All these guys are going to put in their trauma kits now.
yeah, I'll be like, I don't even know how to use it, but I want it.
I have some false unicorn herb here for your gunshot wound. It stops bleeding. We're good to go.
They're really cool herbs. I carry a bunch of them. They're maybe $9-10. And I just leave those in my pack, and I give those to moms postpartum, and it'll either make a placenta deliver if you got a sticky placenta, or it will stop bleeding postpartum. I probably throw away pit way more because it's expired, because of the fact that I can use those herbs and it will stop. Pitocin contractions are really make women very nauseous. And they're really intense. And I'm not saying that I won't use Pitocin if a mother really needs it. If she's hemorrhaging, you're getting pit. Okay. Like, I'm not going to mess around with some other stuff. But if there's like early signs of a bleed, or I got a sticky placenta that won't come out and it's been 20, 30, 40 minutes, I'm going to use those. And they'll 9 times out of 10, those work. But if she's truly hemorrhaging, I have, altered mental status, all that other kind of stuff, then she needs again, we're happy it's 2019 and we can use drugs.
So we've talked about herbs, we've talked about garlic, we've talked about pizza, we've talked about breakfast. It's been a great show.
It has. I'm ready for lunch.
Yes.
I'm just gonna say this. I'm hungry now.
What's the closest tissue to placenta that I can go eat?
You want some sushi or?
It's
Yeah.
a filtering organ, so I would say a liver.
Liver. I was going to say the same. All right. I hate
We can
liver.
deep fry it. Let's do it.
I'm out.
We can fry everything in the South. We're good.
Hashtag.
Yes.
Say again.
I said absolutely. We fry everything in the South.
Yeah. I had the best fried chicken of my life in the South, which is probably no surprise to anybody from the South.
Yes.
And I love fried pickles. I mean, we'll fry Oreos, we'll fry Snickers bars. We fry everything in the South.
Sounds delicious. Okay, cool. I was just giving us a little bit of pause there.
We don't want to. We're done. We're not going to talk about eating placentas.
I think we're good. I think we covered it.
That's
like
what we like shooting show. You can go on that show, talk about eating placentas.
We covered it like 5 times. I think we're good.
Yeah.
All right. Yeah, that was good. I'll edit that in. I took notes. So I'll send them over.
There is a reason, Dietrich, just so you know. Like there is a reason for consuming the placenta.
Is it like the iron or what is it?
So it's a replacement of the blood loss, and then there's also the fact that there's hormones in there that can make your prolactin more intense. So for those who have a history of issues with breastfeeding, it's helpful with avoiding or treating postpartum depression because of the chock full of hormones in the uterus and in the placenta. And so there is something called placental encapsulation, which is an old Chinese medicine ritual. It's like very detailed on how you are to properly do that to fit Chinese custom and tradition, and has been done for centuries and centuries. So like it has been done for a really long time. You steam it in a specific amount of herbs, and then it's to be dehydrated very low. And then you make a pulse, you grind it up, and then we have gel caps, right? So we can use caps, but they would have used it as a powder, mixed it with water and chugged it down.
You don't seem convinced.
Luckily, I feel fairly certain that I'm done having kids unless something happens. So I think I'm good.
Right. But I mean, if you think about it, like if you think about old, like Wild West, I mean, the husband just couldn't leave his wife and 3 young children to go to the grocery store, right? Like he had to think of a way to fix an iron deficiency, a blood loss issue, all that kind of stuff. And that's why they would cook those in the past. I mean, if you think about it in like survival, it's Wild West, and like I can't just go throw that in the trash either. I mean, again, you can't just get rid of that. Like that attracts animals too. It comes back to like survival issues. Like that would have tracked bears and mountain lions and all sorts of things if you just hucked that in the garden,
Yeah,
definitely. Awesome. Well, thank you for coming on.
No problem.
it was great.
You got a little midwife history lesson, and you didn't even know it.
Yes,
I love it. Yeah,
that's awesome.
The
Thank
whole
you.
thing is awesome.
You're so welcome.
Yeah,
Cool, guys. Thank you.
thank you. Keep trying to embarrass me online. That's fine. I love it.
I asked Dietrich that too. I was like, doesn't he have kids? And you're like, yeah, he's got 4. And I'm like, I don't know how I'm supposed to embarrass him then.
I honestly don't think I can be anymore. We like shooting and having the worst friends on the face of the planet.
Oh my!
Having 4 kids, 2 daughters, 4 grandkids, and
you have 4 grandkids?
Yeah.
How old are you?
46.
He's old.
Apparently, I don't feel old.
He just started really early.
I did actually.
Oh, okay. You were having kids early, and now they're having kids early.
No, they all had kids in their 20s.
Okay.
Well, and honestly, my sons are almost 30.
Oh.
We were all just playing video games while Sean was doing something else.
Yeah.
Yeah, I guess. Maybe I missed out. I don't know.
Well, no, because like the first 18 years were garbage. And
Oh.
after they all moved out and went to college and stuff, then things got really cool. But yeah, that first 18 years. Oh,
First 18 years is a rough one.
yeah.
There's a,
Life.
there's a few rap songs about that.
Yeah. But now it's awesome because I just do what I want when I want. It's fantastic.
Okay, well there you go.
But yeah,
Winning.
like let's see, I think she got pregnant when we were 16 and we had twins the first time.
Oh, you had twins?
Yeah.
Wow.
And they'll be 28 in 5 days.
That's awesome.
And then 2 more daughters. I actually had 4 kids before I could legally drink.
Yeah, you were definitely doing things I was not doing at that time.
Oh yeah. And I was dumb. So dumb. So dumb.
I was so
Your pullout game was not good.
No, it was like I didn't even try. But yeah, my ex mother-in-law is a midwife, and
oh, that's cool.
yeah, so it was like all she also a doula,
Uh-huh. That's
which I understand don't really go together, but that's what she did.
no, they go together.
Okay, yeah, I figure like one's more witchcraft and one's more medicine.
No, neither one is witchcraft.
Well, she's kind of weird, but
She may be a witch.
she may be. But honestly, like so, whenever the kids were born and grandkids and everything, she was always there, like kind of lecturing. So I'm like pretty familiar with all this stuff. Not an expert level by any means, but familiar with like episiotomies and like understanding what all that stuff is and preeclampsia and everything. I've been through most of it as an observer.
As an observer, I love it.
Yes.
That's fantastic.
I don't want stolen valor for childbirth or anything like that. So I have to stay as an
Ooh.
observer.
Hashtag red flag.
Yeah, exactly.
Oh my gosh.
All right, I love it. Jessica, it was a pleasure.
Thank you so much. I'm so happy we got to hang out.
I know.
Definitely.
I know. We should definitely do it again.
So Secret can show up.
Yes, I can actually show up.
Exactly.
And maybe I'll bring someone else on, so I won't be the third wheel.
There you go. I love it. Do you ever go to like NRA show or anything like that?
No, I guess I need to start doing that stuff.
We could get you a husband there.
Yeah. Oh, are you looking?
She is looking.
I'm
Okay.
on the market. I'm taking applications.
All right.
I tried to turn her into a gun bunny. I was like, hey, if you turn into a gun bunny, we can definitely get you some men. And she
He's
didn't like that idea.
Not the right ones.
well, hold on. Preface that appropriately. He said I needed to be half naked holding guns.
Yeah.
Yeah.
No, I knew what he meant.
Isn't that's what gun bunny means?
Yeah, that's turning you into a gun bunny.
I don't think that my ass needs to be on Instagram.
I mean, there's a couple pictures of you holding babies with the boobs popping out a little bit. I'm not gonna lie.
Well, I can't control my photographers.
It gets a lot more likes.
It does. Wait, let me look.
I bet you it does. Like if it's just a picture of her in her EMS uniform, not very many likes. If your boobs are showing, you get tons of likes.
I can't see how many likes anymore because
Instagram did it away.
Yeah.
Are you kidding me? It's all gone now?
It says liked by this and others instead of a number.
God, fucking inclusive dumbasses.
I know.
Oh, I still got it. Look.
So yeah.
So that one.
Okay, there you go. So for me, I don't see it. I see and others.
So that one says 314.
Okay.
So the one you said the boob was hanging out.
Oh, that's go down a little bit more to me delivering the baby with the military guys.
Well, there's one even more. Hold on. I saved it. It's on May 22nd, 2018. She's wearing a hoodie with a baby in her hands.
Hold on. So many pictures.
Oh, because it's just boobs in general. Oh, you're not talking cleavage showing. You're just saying boobs in general.
Oh no, it's cleavage. It's a lot of cleavage.
I don't know which picture this is.
Here, I'll share my screen.
Trying to find this picture.
That one.
That's
Oh.
a beautiful picture. That's a real.
Man, you are way down on her list.
I
Okay.
love that picture.
It
Oh,
is.
there it is. I see it.
Such a fun birth.
Oh, that was old. It only has 52.
Yeah, that's old. That's why.
You should reshare that one and see how many likes you get.
It is a cute picture, and I actually noticed it again up here when she's doing a seminar because it's up on the big board. Where is it?
Oh, that's. Yep, that one. Go up. Stop.
Oh yeah. Oh, and I saw it one more place as well.
Oh,
She likes that picture.
that was such a fun birth, though. I really loved that picture.
The joy in your face. Here it is. Yeah, like literally, you could tell. You could see the joy in your face. It's awesome.
Yeah, that was a. I had delivered the mom's babies, and then that's a daughter's babies. Does that make like?
Yeah.
So it was. Oh, it was so beautiful.
It's so awesome. Yeah, I went all the way down to the bottom. What do you use for fake blood? Because that looks really real.
Oh my God! Are you talking about the mannequin with the woman behind it?
Oh shit! I stopped it. Yeah, here. This one.
Do you want to know what that is?
Yeah.
Yeah.
It's ketchup and water.
What the hell?
Yeah.
It looks pretty good.
Yeah, I just basically took that like that. Well, it's Whataburger
This is
ketchup.
what Sean would be doing. That one right there. Or the
Yeah.
student. That is Sean.
I
And
watched that one. Yeah.
yeah, that is something you would be doing right there. 100%.
Yeah, that's the Whataburger ketchup. So that's like really thick, like steak sauce kind of ketchup. And then I thinned it down just a little bit. I'm not gonna lie, I wanted fries and a hot dog later that day because it's in there. So there's that. But
Never trust Dietrich. He says he uses like Caro syrup and chocolate and shit. No. I tasted it and it was awful.
oh, that's gross.
So, funny story is like Sean had told me he was using dish detergent and food coloring. I was like, all right, cool, we'll try it. So I
Ooh.
tried it and I was like, all right, it's a little foamy. It feels good, but it's a little foamy. So then I started doing some more research. I found out these guys were using corn oil with chocolate syrup and food dye. And we used it and I was like, oh, that's it. That's perfect. And so I tell Sean about it and we're teaching a class together. And I look over and he sticks his finger in the cap and tries it. And I'm like, oh, I had some leftovers. I didn't bring the good stuff.
Yeah, that it was soap and it was bad.
Oh my gosh, that's funny.
Anyway, I'm kind of retarded, so I don't know if you noticed.
Well, I gotta pick. Oh, that's a good video.
Oh, here you go, Dietrich.
You're getting kicked off Instagram for this. I'm flagging that one.
It's already flagged. It was covered.
Yeah, it was already covered.
Oh, yeah.
I already got in trouble. But it's such a good. This is an old Navy instructional video.
Oh, wow. Interesting.
Yeah, the voiceover is phenomenal.
Aw.
Oh, no.
No, there's no about it. That's gross.
I've seen it up close multiple times. Look at that cord wrapped around the neck.
But it's such a good informational video. I show it in class all the time because it has a cord and everything.
Boop.
I know. Isn't that cool?
Yeah, I can't post a picture of a gun, but this is fine. Man, that looks like a pretty big hemorrhage.
Oh, it's pretty normal.
Is it? Oh,
Yeah.
Ah.
look at-
Ah.
I mean, it's just pretty cool because the placenta comes like out all by itself. So
Yeah.
that's why I show this video all the time.
That's insane. Mm.
Dang. I've literally seen it live 4 times. It doesn't even bother me anymore.
Oh, that's a good one too. I think this is a breech baby.
Is she standing?
Yeah, she's kind of standing, kind of kneeling. I think she's on her knees a little bit.
Oh, okay. Oh yeah. Holy crap.
Oh, that would suck.
Yeah.
That would suck.
There's those arms. Oh, man.
Yeah.
Yep.
Fake
I,
the seizure.
oh, that's from behind. I see. Okay.
Yeah. Yeah, that's position they tell us, like the breech phase, to put her butt up in the air, face down,
Yep.
throw them on the stretcher, and haul tail to the hospital for us.
That's such a cool video. That was a really good one too. I liked that one.
It's awesome. All right. I think that's all I can make
Awesome.
uncomfortable with.
Okay.
Perfect. Bobby is ready for us, Sean.
Cool. Jessica, it's a pleasure again.
Thank you so much, guys.
Thank you, Jessica. I appreciate it.
Yeah. See y'all later.
Bye.
Bye.
Diedrich, I'll have to send a new one. It'll come over in just a minute.
Perfect. Thank you. I'm going to go pee too.
Okay. Bye.
Bye.